Good afternoon, everybody, and welcome back. You spot the miscreant entrepreneur a mile off, can't you, Reid? I mean, honestly. Welcome, everybody. Welcome here in the room in Singapore, and welcome if you're tuning in online or catching up later on. An action-packed first day here. To our honoured guests, so far you're enjoying your time with us, I hope. Yes, okay, well, I know it's post-lunch, isn't it? But are you enjoying your time with us, I hope? Yes, that's more like it. Now, a big thank you if you've already submitted your questions to us, because they really are the sort of lifeblood of these conversations. We want to know what's not been said, what's struck a chord, what would you like to bring in terms of your own perspectives. That's really important. So this session is on business in action, and forgive me, I gave you a bum steer before lunch because I very wrongly and unforgivably actually said focusing entirely on the private sector, which we're not. We're talking about business models across sectors and actually rethinking how the world works, really. So Katie rightly took me to task. Let me tell you who's up here today, and then Katie Overby will introduce the session. Why don't I start next to me? Great to meet Reid Fars in Dubai, and delighted that he's back here. He is, of course, the leader of National Vision, known to many of you, I am sure. Reid, welcome back. Very nice to see you indeed. Next to Reid is Prashant Gar. Prashant from LVPEI. That's the LV Prasad Eye Institute. Welcome, Prashant. Thank you for being with us. And next to Prashant, we have Ryan Toes from Fundación Vision. Thank you very much indeed. Also known to many of you, Katie Overby from HCP Cure Blindness. That's the Himalayan Cataract Project. Perhaps a round of applause for all of our guests for this session. Thank you. And Katie, if it would be all right to ask you, help us set the scene for this session and just get our brains going, please.
Thank you, Ali, and good afternoon, everyone. It's always fun to be right after lunch, so hopefully we're going to be very exciting topic here and keep everyone awake and engaged. But it is really exciting to be back, having this conversation. For those of you who were with us in Dubai, we really started out saying, as we think about the shared mission that we have to ensure that everyone everywhere has access to sight and to the vision care that they need and deserve, a key element of that is really thinking about how do we build long-term, sustainable, systemic solutions everywhere. And so at the meeting in Dubai, we really started out by saying, what role does the private sector play as we think about those solutions? And we were really honored to have a mixture of speakers from a number of different private sector companies. And we looked at a mix of models that changed the cost curve, as well as other approaches. But we also spent quite a bit of time talking about the role of the private sector from a philanthropic standpoint. And so as we thought about how to continue and advance that conversation, this year we said, well, truly to be a long-term solution, we want to make sure we're also focusing on what are the actual elements of a sustainable business model so that something doesn't rely on ongoing philanthropy. And so really that was where the idea for today's session came from. And I'm truly excited and honored to be joined by the three leaders on the stage with me, plus Ali. You're a leader on the stage as well. And what's I think very interesting and hopefully will be informative for all of us today is we're looking at different models that run the range of private sector to social enterprise to NGO that address refractive error as well as ophthalmology. But what's common amongst all of these is they've found different approaches that enable them to be fully financially sustainable, as well as sustainable more from a human resources standpoint as well, which are both key considerations for us. So I'm very excited today to learn more about these different models and hopefully together think about what are some of the common learnings that we have and how might each of us be thinking about these elements as we're thinking about all of the different places and focus areas where we work. So with that,
100%. Thank you, Katie. Please come and have a seat. I'd say, that set the scene perfectly. I'm going to be listening for three things in this session, if that's all right. The first is the questions from our colleagues in the audience. The second is we want us to feel candid about sharing the challenges that you've faced, because it's a showcase, and we want to hear that, but also the partners that you've worked with. So I think Katie and I will be particularly listening for that. Ryan, if you don't mind going first, we've put you on the clock, if that's okay. We've got 7 minutes. You could have 70 minutes, but today it's 7. So we'll give a warm round of applause as you approach the lectern. Ryan Toes.
Well, good afternoon. My name is Ryan Toes. I have to confess something. My first time in this beautiful city and in Asia and at APV global event. So I'm thrilled and honored. To solve a social problem, we usually face different problematics. So I would try to share with you one way how to address it. I call it the ecosystem for sustainable social programs. Why is it ecosystem? Because an ecosystem there's many different subsystems that needs to work together to survive and to grow. So we call it ecosystem. So there are 3 main areas: the health service, the fundraising, and the business sector. Well, in health service, we have like a filter system. Well, you have to know the need, come up with a service option, select the ones that can be massified because you need high volume, and then find out if they are cost effective. If not, then you start the process again. One important effort that we do is try to achieve economy of scale. This is something that, well, there are different efforts that we use, but these are some of them. Are the way we work is we hire the staff and the doctors on a waging system, on salary, monthly based, and not a fee per service. We procure in large quantities. We have a residency program to have a lower cost of labor force, and we make use of telemedicine whenever it is possible. Another main issue is the work with allies. So who are our allies? Is the ministries of health and education, the city halls of municipalities, local NGOs, international NGOs. And as a principle in our institution, we try to avoid free services whenever it's possible. We have a low-cost system, we have subsidies, we apply them to the vast majority of the patients, but we try to avoid it. Why? Because sometimes it's an ineffective resource allocation, and we try to fulfill the gap with the next pillar, that is fundraising. So we have fundraising as a concept. So we have a department of fundraising, we have a department that are looking for projects at a national and international level, and we have also a department of institutional relations with other NGOs and companies too. What we see in the fundraising, what I see at least, is a kind of a shift between the regular donor to a social investor. That means that the social investor wants to measure the social ROI that comes from investing. And that means that there's less and less free donations for the institution. This is in our case. So we see that like dropping the free donations that we can use discretionally. It's dropping, and they are getting more involved with what to support. So that leaves us a gap again, because we need the free donations for our use too. What we did is we have the third pillar is the business sector. So we have companies that are working with us, and basically two ways. As a shareholders, where we are shareholders of the companies, and others that are working with us in a stakeholder relation. So the shareholder relation, where we are owner, the profit that means that every year come to us, just fill the gap in the fundraising area. We can do common projects with them. We have better prices for patients. Sometimes we have to break monopolies with them. So they are like family. And the other group are the companies that are our stakeholders. There we develop a kind of win-win relationship. So we need a constant demand of things. We need it, they can provide it, we can fulfill each other's needs, and they give us special price, special conditions. We can secure stock. This is something that was really difficult for us at the beginning, to have faithful providers who can secure the stock for us. And we have indirect benefits with low risk. And starting this year, because we are like an ecosystem of many companies, we try to create an incubator. This is an idea that we are developed now. Hopefully, for next year or this end of the year, we're gonna have an incubator or accelerator of ideas. It could be a social enterprise, could be a business enterprise. Because we have a lot of know-how inside the Fundación Visión and in the companies that are related to us. And we want to create and take advantage of the synergy that can be happening among us. And so hopefully by the next year, we're gonna start creating new projects. So I think this is it. Less than 7 minutes, and I hope that it was helpful for you. Thank you.
Thank you, Ryan. Please have a seat. Katie, that was a terrific start, wasn't it? What a range. What's going through your mind as you listen to Ryan present?
So first of all, yes, thank you again, Ryan. That was fantastic. And you know, I had the pleasure of being able to chat with Ryan in advance and learn a little bit about the fantastic work that's happening there. And there were a couple things that stick out to me. The first is that you've really found a way to almost have vertical integration, where you're bringing your businesses together, and that gives you lower costs and things that sort of fills that gap where traditional fundraising might be. But then the other piece is really thinking about in the services itself. It really struck me that from a access for patients, you know, the sliding scale of cost that you have to them, cost to the patient, and the importance, and you mentioned it here, of whenever possible, not having it be free, just from a cultural standpoint. And yet also maintaining costs on the provider side. You mentioned that you hire your surgeons on a salary basis as opposed to a fee for service. And therefore, you know, as a salary, but then having quite a few surgeries in, the cost per surgery is significantly lower. And yet that's a win-win for those doctors, because for many of them, particularly those who may be newer in their career, if they were operating on a fee-for-service, which would be more typical in the country, they might not have as much of a patient load. So in fact, they're keeping the doctors whole while lowering the cost per case. So a couple things that as you put them all together is really what makes it work. It's very, very innovative.
A couple of thoughts. Ryan, on the partner companies, we talked in our opening session about welcoming new individuals to the table into this community. Can you give us an example of the sort of company that you might have partnered with? Because it might be easy to assume that they were eye care related, but help us understand the breadth.
You mean from the group of shareholder companies?
Yeah, you talked about your allies and companies.
Yeah, so we can give a few examples. So we have an optic store chain, because we noticed that all the refractive error, so we try to drop the cost and do it effectively. And then after a while, you will see a lot of optic stores next to us with a much higher margin. So we try to break it a little bit, so to maintain the impact of the total cost of the family should be also low, not just our part. So then the idea was to create optics. So we started with a few of them. Now I think we have 12 optic stores next to the clinics, but also it is a separate company. So they have their strategic planning, and they grow also without the Fundación.
Yeah.
But it's for helping. And also pharmacy, and we started last year with clinical laboratory.
Yeah.
So we're trying to surround all the needs of the patients.
Yeah. And my second question, and Katie, you tell me if I'm straying into inappropriate territory. In many companies, you see incentives for success. And in our measurement of standards session before lunch, you saw this clear gap between operations performed and successful operations. Has there been any pioneering work in your experience in adding a bonus or an incentive for an operation that is successful?
If I understand the question correctly, you are asking if we have a bonus system?
Yes.
Right?
Because it'd be easy to say all operations are treated equally financially. In another universe, there's an additional payment should those interactions be successful.
Yes, it's internally with the surgeons.
Yes.
Okay. So no, we don't have any. What we try to do is we try to look for people that want to work full time and exclusively.
Uh-huh.
And if they're not all like that, but we try to have a set of different kinds of benefits for the group that is exclusive for the institution.
Got it.
And for those, for this group, they are important for the institution. So we try to contain and be supportive
helpful. No,
with
I
them.
see.
Yeah.
I see. I mean, Katie, my other takeaway was simply this idea of fostering this entrepreneurial community with the incubator accelerator model, because you could see that value exchange going both ways to the new organizations, but also to learn from these entrepreneurs.
Yeah, and I actually, for me, it goes back to how you started off, Ryan, talking about it's an ecosystem, right? And how all of these work together to fuel one another. But at the end of the day, it comes down to the common mission of ensuring that you're serving those in need of care. So.
Yeah. Did you think, we just got another sort of minute, Ryan, your model for that incubator or accelerator, is that a tough one? Have you fleshed out what you think that will look like?
It's a work in process. We just started, so
Watch this space.
We are still developing the model of how to address it.
Yeah.
So we just started the brainstorming a few weeks before I came here, so it's just starting.
No, understood. No, please keep us posted. Thank you. Why don't we say thank you again to Ryan Toes? Thank you very much, Ryan. Well, now that they know they're being grilled, I can see Prashant and Reed getting nervous. But why don't we welcome up with a warm round of applause, Prashant Garg. Well done.
Thank you, Ali, and good afternoon, everyone. I think it's a very interesting session to really look at the models that allows you a long-term sustainability. But this becomes more challenging if you are working in a not-for-profit organization and you want to reconcile excellence with equity. What I'm going to do today is to share with you how at LV Prasad Eye Institute we are trying to create a long-term sustainability while maintaining excellence and reconciling it with equity. When I'm saying equity, I mean that we are not going to deny anyone the care regardless of the complexity of the case. That is what we are practicing. We started as an advanced tertiary eye care center, and today we are present in 282 locations physically. But these locations are very strategically designed such that at the apex you are providing care to the most complex diseases, but at the bottom of the pyramid you have a wide network that is allowing you access into the community. This model was developed out of a large public health study we call Andhra Pradesh Eye Disease Study, and you can see that the model extends from a population which is 5,000 to a center of excellence at the apex, which is catering to the population of roughly 1.5 million. The first baseline physical structure is a vision center where a 1-year trained vision technician is given the responsibility of taking care of uncorrected refractive error and also picking up cases which requires care at a higher level and making the appropriate referral. In this model, our vision technician also participate in community screening. And all the patients who walk into these centers are provided care at no cost to them. At a secondary center level, where an ophthalmology-led team is given the responsibility of primarily taking care of the cataract, but also providing medical care for glaucoma, diabetic retinopathy, and then making referral to higher center, close to 50% of the patients are treated at no cost to them. If we look at the tertiary eye care centers, which are a typical medical college ophthalmology departments, we provide not only care to the complex diseases, but also are engaged into providing training to all cadres of eye care personnel, clinical research, and other activities that happen at medical college ophthalmology residency program. And here, when we looked at the data, we have 3 such tertiary eye care center, and close to 35% of the patients who are treated there are treated at no cost to them, whereas 70% of the patients provide or are being charged for the care that we provide. At the Center of Excellence, we not only do these activities, but also are involved in innovation, product development, we do advocacy, policy planning, and other activities. And here again, 30% of the patients are treated at no cost to them. This is the chart that gives you a glimpse of what are the numbers that are being treated in our network at different levels. If you critically look at it, at Vision Center, Secondary Center, Tertiary Care Center, and Center of Excellence, the volume of work is roughly about 25%. Now, what are the costs? Vision Center, since all the patients are being treated at no cost, there is no revenue from patient care per se, but we generate revenue from the sale of glasses. Whereas from secondary center, they are, because of the cross-subsidy model, we are able to make them cost-effective as far as the operational cost is concerned. And tertiary care centers and the Center of Excellence are able to generate some surplus, which is cross-subsidizing activities at secondary and vision center level. So overall, if we look at the operational cost in this model, we are cost sufficient from the patient care as far as operation cost is concerned. We need to generate revenue only for our capital expenses. And what are the sources available to us? It is the business or the revenue generated from business. And business, I'm talking about primarily the sale of spectacles. And more recently, we have started a contact lens manufacturing unit, which are manufacturing specialized contact lenses. We have a surplus or we have a reserve which give us revenue from its interest. They are being very strategically invested. And close to 13% of our total expense, including capital, we need to depend upon the philanthropic support. So overall, in our model, what we have realized that if we are, over a period of time, able to take care of our capital expenses for operational cost, we have self-sufficient from the revenue generated from patient care itself. Thank you very much for your kind attention.
Thank you, Prashant. Well, guests, you might need to take some notes because there will be time for questions after our 3 presentations. Our guests have all asked to make those questions as difficult as possible to keep us on our toes. That was fascinating. Katie, really interesting model.
Absolutely. And you know, as I look at the way in which you've built this model and then built it out and further, you know, what strikes me is the intricacy in a beautiful way of managing this balance between paying and non-paying at each level, And dare I say, it sort of goes back to this ecosystem concept, because not only do you have that balance of paying versus non-paying to ensure, the balance, but then across your different centers as well. And then, of course, then as you got into the cost recovery, it goes beyond just the direct, payment for service, but some of these other aspects of it as well. And so, it's really a beautiful mix. I guess one question I would have is, for you, is how actively do you need to manage that? How closely do you track the percentages of paying versus non-paying? And how do you make sure that you stay within the bounds there?
I'll say that we have not to actively manage any of those things, but keep an eye on what is happening in the network. It is primarily because I think our experience has been that in any community there is a mix of people who want to pay for their services. There is, on the other hand, people who cannot afford to take care of their health-related issues. And as a society, if you actively ask the people who can pay for you will find a segment of people who do not mind getting the most high or highest quality, but that cross-subsidize the care of those non-paying patients.
So how does that, Prashant, how does that work in practice? How do you decide who pays? Because it sounds like you're making it optional.
It is optional, and what we have is that even in the paying category, we have three cadre of care available. One is where it is cost to cost, another is double the cost, and another is about 3 to 4 times the cost. And I think the second and third group of people are the one who are cross-subsidizing actually the care for the non-paying patient. We do not actively promote anything. It's a model that probably you can understand very well from the airlines model, the business class, or economy class, premium economy.
Yes.
And in some way, through this model, while keeping the quality high, you are still able to take care of.
But it's still a communications challenge, because I suppose even in economy, you're guaranteed to get there. So you can't, you've got to be careful with how you communicate.
Even for the people who are not paying for their services, we ensure
Yes.
that they achieve what they want to achieve.
Yeah. Do you have anywhere, forgive me, Katie, just final question from me. Do you have anywhere in your ecosystem a financial investor who expects some form of financial return?
No.
Why is that?
It's primarily because as soon as there is a financial interest of one party, the model gets skewed toward ensuring that it is constantly generating profit, and you lose the focus on the service aspect of it. So we want to make sure that at any given point of time, you do not lose the sight of care of the people who really cannot afford their services, and it should not really be that the profit is the...
Okay. And what would you say to a social entrepreneur in the audience who says, well, we are constantly walking that tightrope and we balance these things and it is possible for us? Would you entertain such a thing?
Social enterprise who want to participate with us on the term that we are a not-for-profit organization, we join hands with them. Provided there is no expectation set forth that I expect this return, financial return.
Yes, okay.
Productivity return, yes, we also want to work with those challenges, that if there is a better productivity model, we will like to take those challenges.
No, understood. No, thank you. And we can unpick this more in our questions. Katie, any final reflections? This has got us thinking.
Well, I think your analogy there of the airlines is an interesting one, right? So the first class, the business class, the economy. One thing that I think is very important to point out, though, is the quality of care is not the differentiator, right? So whether someone pays a lot or nothing, the quality of the actual medical care is the same. Right. So what would be some of those differentiators then that someone would be paying for?
So some of the differentiators are that you probably may have a separate waiting area which is less crowded. The products, some of them like to get imported products only to be used in the service.
Yeah.
So those are the two major differentiators that we offer.
So more on customer experience.
Yes.
Exactly.
Yeah,
It's more the experience as opposed to the quality outcomes, all of which are expected to be high. No,
Yeah.
that's a-
Really interesting. Could we have another round of applause for Prashant Garg? Thank you, Prashant. And please, guests, field your questions in due course to any of our presenters today. By no means least, very happy to welcome back to our gathering the leader of National Vision. Please give it up for Reid Fass. Good to see you.
So this is odd for me because my colleague Jackie Grove and I come to things like this with our philanthropic hat on. And to be asked to talk about the other side of our life is unusual. And it is another side of our life, and frankly, a contrast to what's been discussed already. National Vision is a business. It is a for-profit business. We're a public company. You can pull out your phone right now and buy stock in the company, and I'd encourage you to do so. That would be great. We are a business that provides eye exams and eyeglasses to budget-conscious, low-income Americans. This is, and it's a scalable business. We do it at scale in large numbers. Frankly, this is what I think we're eventually hoping to have in all countries around the world, a business that can do this and do it profitably. Our vision is we believe everyone, and that's around the world, everyone deserves to see their best, to live their best. And we help people by making quality eye care and eyewear more affordable and accessible. This has been our mantra for years and years, and that's what we're all about. Let me give you a sense of the scale. We have sales of $2 billion a year. We have 1,350 stores under 5 different brand names. We have 16 e-commerce websites, 15,000 associates, and over 2,000 optometrists associated with us. That's about 8 to 9% of all optometrists in America are practicing next to our stores. We will hire, as we were talking about, salaried, we will hire about 10% of all the graduating class from the optometry schools next year. We did that this year. So, and we will serve over 9 million customers annually. So this is a business at scale serving low-income customers and helping them save money on eyeglasses, contact lenses, and eye exams. What I find really interesting when we're talking about this is if you look at the top 5 optical chains in the world, 4 of them, Specsavers, National Vision, Fielman, and I think Walmart. There aren't public figures on their global optical sales, but my estimate is Walmart would be the 5th. 4 of them are aimed at low-income and budget-conscious consumers. Okay, they are businesses whose DNA is about low-cost eye exams, eyeglasses, and contact lenses. The fact that 4 of the 5 of the largest optical businesses are about serving low-income customers, it says something. It says something about the potential of how this problem of the lack of eyeglasses for low-income people can be solved. We refer to ourselves as a low-cost provider of a medical necessity. And frankly, as a business, that's a great thing to be, a low-cost provider of a medical necessity. A low-cost provider of a medical necessity should never be a bad business. It should be a great business on an ongoing basis, and we've had a track record of pretty long-term success. Our core entry offer is 2 pairs of eyeglasses and an eye exam for $79. It's very hard to find an eye exam for $79 in most of America, but to get 2 pairs of glasses and an eye exam for $79 is a great deal. Our largest chain is called America's Best Contacts and Eyeglasses, and its advertising line is, it's not just a great deal, it's America's best. How do we do this? We have private label frames. Guess what? Branded frames, they're expensive because you're paying for the brand. But we go to a number of different Chinese factories and factories in Vietnam and Cambodia and buy glasses that are just for us. And we buy them directly and land them directly. We have a very highly efficient lab network, 4 labs in America, 1 lab in China, 1 lab in Mexico. And we have an algorithm that figures out that for every customer purchase, where is the absolute cheapest lab in our network for that pair of glasses to be made, but a very highly efficient supply chain, lab network, and distribution service. We employ optometrists. That way we can bundle the sale of glasses or contacts in with the eye exam. And we have very low-cost real estate. We look out for inexpensive real estate, which appeals to low-income consumers. But this generates tremendous economies of scale. We have a cross-subsidy model. We were talking about that, where, yes, if everyone bought 2 pairs for $79, it would still be a profitable business, but not nearly as profitable a business. But luckily, some people do want fancy names on their glasses, and at our highest level, we have Ray-Bans and Oakleys and some things like that, and people will trade up for things like that, because even low-income people want to look good, and sometimes they'll say, I will stretch for that image building aspect. Some people want better lenses, want anti-reflective coating or transitioning lenses or whatever, and the people who buy those, it helps to subsidize and makes the whole thing more profitable. We also give away product, and you were saying you try to minimize the number of free pairs you give. We say we'll give away those that are needed. Everyone in our stores has the ability to give away a free eye exam and a pair of glasses to someone who they think can't possibly afford even our low-cost services. And we'll probably give away 35,000 eye exams and pairs of glasses this year, and that's up from 30,000 last year. It seems to grow every year, but you don't have to ask permission. You just can make the decision, anyone in the store, and it's a wonderful program. It's great for those that we help, but it's also great for making associates want to work with us and stay with us and be employed by us because they feel good about the sort of work they do and the culture they're doing it in. There are dozens of different low-cost models in the developed world. Different ways that you can structure a business and make money and still provide eye exams and eyeglasses at very low cost. There are a lot of different models, and someday we'll be standing on this stage and talking about a lot of different models that are working in lower income countries as well, because those models are out there. But in my mind, to solve the problem of the billion-plus people who need eyeglasses and don't have them, is you're going to start with the collaborations of NGOs like we're talking about here, and like we've all been involved with for years, and through advocacy and awareness and affordable access, you're going to get the population to a tipping point where a certain percentage, I don't know what that percentage is, where a certain percentage of people have the glasses they need. It will become normalized. It will become sort of a common thing, and then entrepreneurs will emerge and create the Specsavers and National Visions and Fielmans of the future in each of these countries. So let's say the NGOs will get the category to, I don't know, call it a 30 or 40% penetration rate that's a tipping point, and then I believe entrepreneurs will come along and finish the job, and that's why I think we can get this done in our lifetime. This is, as we've all been hearing, the era of collaboration. This is where we're all coming together and using our individual superpowers to get to that level of penetration that is going to allow us to solve this problem within our lifetime. Thank you very much.
Fab, Reed. Thank you very much. Katie.
So Ali, it's so interesting to me because in so many of the discussions that all of us have around the collaboration and around thinking about long-term solutions, we don't actually spend a lot of time talking about lack of access for consumers in high-income countries like the U.S. But I think it's important to note that this is a problem everywhere, and so it's really interesting and encouraging to me to see that there are solutions like this. But I think, Reed, one of the things that you said there is it's still about how do you make this model sustainable, right? And then if you can do it in the US, how do you do it in other countries where maybe the revenues are a little bit lower? But you talked about all of the different focus areas that you have in terms of containing cost, and those economies of scale. So I think those would be some of the principles that I would look at and say, how do you ensure? Because that way you can continue to run the business as a business. Right?
And it's sustainable and scalable. The profits we make from, of the 1,350 stores, we built 900 of those since 2006. We build between 65 and 85 stores every year from the profits generated from this. we have no philanthropic dollars involved in this. It pays for itself. It scales itself. This is a lovely product. It's 5 pieces of plastic held together by 2 screws. It's not a crazy expensive product to get out there. It's finding the models that are going to work. And there's always, in every country, going to be a need for some aspect of philanthropy. There are people who just simply can't pay. But for a business like ours, sort of serving those people in America on a philanthropic basis and around the world on a philanthropic basis, it's deeply culturally enriching. It makes people want to be a part of a company like that. It makes people want to stay. People want to know that their work is more than just helping a company make a profit. They want to have impact in the world.
Reid, on that then, can I ask, leading a public company, with that comes scrutiny, transparency, pressure on reporting, possibly more often than many listed bosses I interview would like. To what extent have there been times when those pressures have come into conflict with the social change maker, which you also are?
You know, we live in an age now where a lot of classes of investors are seeking out investments they can feel good about. They're saying, let's avoid tobacco, and they're trying to find, they're called ESG investors, environmental, social, and governance investors, and public companies are asked to report annually on what they're doing to make the world a better place, and that's everything from climate action to social benefits. So we think it's actually a perk to be able to say that we're doing this, and there is, I felt no pressure not to be doing anything like this.
Is there an example, just for our audience here, of something you're now reporting on that historically you wouldn't have been putting a number against? I just want to give us a sense of that evolution.
I mean, greenhouse gas emissions are, it's things like that. But we also report on the number of people we help philanthropically. Yeah. I mean, the markets are anxious for any data you'll give them. So anything they can track on an ongoing basis, you actually have to be very careful, because once you give the markets a number, you always have to give them that number. So the decision to, I'm going to publish this number is a real decision. But we publish a social impact report every year with everything from how many people we're helping philanthropically to greenhouse gas emissions pieces, and what we're doing to take care of our employee base, and as well as diversity, equity, and inclusion numbers. And most public companies are now reporting their social impact.
100%. Katie, I'm conscious of our time. Have you got another reflection for Reid?
Well, actually, it's something you just said just sparked the thought, which is really each one of these examples have talked about the role of a social investor, right? So someone who either is maybe a patient who wants to pay a premium in order to enable someone else to get care, or it could be truly an investor but who's socially minded, or even you talked about those who are looking for that social return on investment. And so it's differentiated from standard fundraising or donation, and yet these are 3 different models. So I think that's also a pretty fascinating.
That was the one I wanted to just query, actually, was Ryan's perspective, because you used that phrase of social investor and you talked about their social return on investment. Have you got social investors or investors in the mix who expect to return financially, but not necessarily maximizing that return?
I think the social investor, I think you still have at least like 2 different. So you have a group of people that will want to know the impact of their donation directly. So it's just a donation to use it. Then it's others that with this incubator we want to engage others that will, and we have an example already in Paraguay of people that invest without expecting returns.
Yes.
Yeah. So if the cause, if the numbers, if the impact convince them, right? So there's 2 levels or 2 different kinds of social investors.
Well, I suppose Katie, what I'm exploring is this idea that historically you've had a category of investor that, particularly because of the type of corporation, a C corporation, have expected the board to make decisions which will maximize the return for their shareholders. And I'm just wondering whether you're seeing, or any of you are seeing, a type of investor emerge who expects a financial return, but understands that the decisions that the organization makes will be in the interest of the wider stakeholders, not just the cash investors.
I'm seeing that people are seeking a balance of being good with your customers and making them very happy, of being a really great employer and having a good work environment, a good, fair environment, and being aligned with your broader community and your broader society's goals, and concurrently giving a return to investors in the case of a business.
Yeah. It struck me that your free services, Reid, are essentially discretionary. You have empowered, hyper-empowered your teams. May I ask why you haven't codified that more along the lines that we might have heard from Prashant, for example, in terms of who gets it, but in terms of systematized, who gets it for free?
So I was talking to one of our newer doctors. She had joined us, and she was about 3 months in. I was saying, oh, so what surprised you about, now that you're practicing with us? And she said, when I decided to give the certificate that said free glasses and free eye exam to someone, you didn't make me fill out a form. And I said, well, I guess if you'd like, we'll create a form. I just don't know what we do with it, because we've said you get to decide. And so how are we, what good is the form in all that? And I mean, it's about trust, right? And trust is a very efficient thing, and people will rise to trust. People will say that you're treating them like a respectable adult, and they will be responsible about it. I've never felt there's any
it's a
abuse
powerful
of it.
point. I bet you're also interested in who's getting those free tests.
Not at all. I just figure they're low-income people, and that our associate can figure that out. I will say, I remember talking to I had a lovely conversation with this one customer who was saying when she first started coming to us, she was very poor and in a very bad situation. And again, this was actually before we had this program, by the way. But she said, actually now my life's a lot better. She described all this, and she said, now I come to you because it's a great price.
Yes, good.
And I sometimes think, if those people get that free thing, if their life gets a bit better, they might come back and
100%.
Yeah.
Prashant, did you want to come in on that?
I think there are 3 points that I'll cover, Varish. One is that I think the question of, as a management, do we track to whom we are giving free services? I think that defeats the whole purpose of your social. Many times we have been asked a question that, how do you know that even the people who can afford for their care are not going to avail free services? And we realize that if you look at that proportion, it will not be more than 1 to 2%. And if you put your energy on tracking that 1 to 2%, you lose your focus from those.
But as an investor, I don't like this.
That's
As a
just-
social investor,
it's just
I
like
want
an
you to be
American
tracking
retail.
it. I'm worried.
I would have said the exact same thing. I would have said 2% of people are going to steal from you. You just have to buy into the fact that 2% of people are going to abuse the system, and you just have to move on and design the world around 98% of the people.
So that is one. The second is, I think most of the social entrepreneur who want to join the not-for-profit organization, I do not have experience of the corporate world, for-profit organization, they really want to look at what social impact you are making, what difference you will make. 10 years down the line, what change will I be seeing? And these days, there are a lot of social organizations that want to look at what are you doing for environment protection?
Yes.
What are you doing for neglected communities? The third point that I will
And I'd say the exact same thing about joining our business.
The third point that I want to touch upon, that if you have to have a self-sustaining model in a not-for-profit organization, you need to create a model which is unique. And I think in our group, the capability of treating the most complex diseases is able to draw a lot of patients referred from rest of the India as well as from overseas.
Interesting.
And that really brings in lot exposure of the organization by some of the wealthy people who become our donor and partner.
Right. Well, this has made me crave another hour conversation, but Katie, we're up against it. Either reflections, or I know we're going to want to cast it open ASAP.
Well, I certainly want to hear what questions are in the audience. You know, one of the things, though, that I would love if each of you could just very briefly touch on it is, you know, I know that there are a lot of people in here and online as well who are thinking about the work that they're doing and how do they make sure that it can be as sustainable as possible. And so I guess it would be helpful for us to learn from all of your experiences is what has been the biggest challenge that you've come up against? And do you have a word of advice for people? And just briefly so that we can get to the other questions.
I will tell you the biggest challenge I've had for the past 20 years, and it's getting enough optometrists to service all the demand that we have. And so, you know, you hear about these problems. You know, I was in Ghana last summer, and there were 300 optometrists to serve like 30 million people. I'm thinking, oh my gosh, it's the exact same problem everywhere I go, the exact same problem. But I've said to anyone who would listen, all we have to do to be successful is retain the doctors we have and attract even more of them. And it's frankly the key focus area of our organization. Providers.
Well, for one of the things in our case, at least, was not knowing your numbers. I think that's in our part of the world, at least. The information system maybe it's not so developed. But to know your break-even point, your cost to do it effectively. So I think knowing your number is going to be one of the challenges. And then don't lose focus, because then whatever you need, you have to try and decide the strategy, and then try things, fail, change, readapt, and try again. But don't lose your focus.
I agree. Human resource is going to be the major, particularly the human resource that is aligned to the values of your organization.
Is there a type of role, Prashant, that you struggle to recruit?
Particularly those who are willing to work full-time. I'm talking about ophthalmologists, and are willing to continue to be aligned to serve communities.
Yeah, no, really powerful.
Because so many healthcare professionals have decided they don't want to work 5 days a week anymore. Yeah. Another same
flexibility. Very interesting. Katie, why don't we cast it open for pithy comments? Welcome. I see you there, sir. Questions, and I'm scanning online as well. Why don't we just come down the front and then we'll go back, if that's all right. If you wouldn't mind, just a thank you. Katie, why don't we get here and then.
Thank you. This is fabulous. And Katie, I'm glad that you caught him from saying they're paying for higher quality. They're not. They're paying for different amenities. Phaco versus IOL, or foldable lens versus standard, but the quality is still there. My question is whether you have a 50-50, 50 paying, 50 free, or an adaptation of the Aravind model sliding scale. Can you talk a little bit about how you determine, or your $79.95? How do you determine your price points for the services you provide in the community where you're working?
Yes, it's sort of to Prashant and to Reed in that sense, with the 79
Whoever
point.
wants.
Yeah. And should we just get another question on the front row, because then we'll field around. I'm trying to race against the clock.
3 quick questions. Reed, do you do any advocacy work in the US to try and advocate for more training of optometrists? And to Prashant, I'm interested, does your outreach act as your health promotional campaign, or do you have to build on that? And to Ryan, I couldn't quite work out if you're working with government as well as one of your stakeholders, whether it's completely private. Thank you.
Right, so right, should we just pin those 3 to each other, if that's all right? Ryan, working with government?
Yes, we one of the allies is important allies, the government.
Okay. But as a partner, as a funder?
We do projects together, but not directly a free donation. But yes, we do projects with them.
Yeah, fine. Okay. Reed, did you catch your question?
Yeah, when you said more training, do you mean give an individual one more years of training, or yeah, so what's happened is, as more schools have been launched, more optometry schools have been launched, the bigger schools have have cut down their number of seats. So actually the number of, even though there are, I think, 4 more schools than there were a few years back, the number of graduates has not changed at all. It's ridiculous. I fight with the deans all the time about such things.
Yeah, very good.
So as regards the community programs are concerned, we have 2 approaches. One is that we identify the population where there is no eye care available, and we go and talk to the local government in that area, and then plan the screening of the entire population. And here we work with other NGOs and philanthropic organizations. The other is, as a part of the activity of the Vision Center, they need to go into the communities part of the time and then provide the community care, which include school screening program, the community screening programs. Like that we work. But there's no advertisement or frank kind of that we are this organization. If you want to reach out to us, reach out to us.
Yeah, good.
Okay, as far as the pricing is concerned, I think each of these models are dependent upon the kind of products or the what you call as a supplies you are going to be using. While so say suppose if you are using Indian products, then the cost will be relatively less because these are less expensive products. Whereas if the person wants, no, I want to have multifocal intraocular lenses or extended depth of intraocular lenses, you must change all the cassettes and all of those, then that's how the model. Typically, the price is that the cost of the surgery that we charge roughly is that whatever is the prevailing cost in the city of Hyderabad or in the local community, that will be the price in the semi-private or economy package. The one where we are using hybrid product, which are some are imported. The lens may be imported, but viscoelastic is. And these are all told to the patients that this is how the distinguish or differentiation is.
Thank you, Prashant. Momentarily, Katie?
Sorry, Ryan has an interesting way of setting the pricing that I thought it would be interesting to share.
Please.
Yeah, what we do, what the Fundación does is we have a conversation with the patient and the relative and the family. So what kind of IOL will he use? Will be used as a conversation with them to see how much subsidy, what kind of level of surgery, if they have the chance to decide, yeah, then they decide if they need a better IOL or not. So this is a conversation with them, and that is made by social workers. So we have social workers in each clinic.
Interesting. So we'll go into the middle in just 1 second, but read a very quick question from online. This is Khaled, who asks, would you mind giving us an example of a partnership between your company, National Vision, in the US and an NGO? Is there an example?
So for years, we've been partners with Restoring Vision for well over a decade. We have been partners with Vision Spring for well over a decade. We supported philanthropically the distribution of 1 million pairs of glasses last year. But those 2 groups and the coalition are 3 major focal areas.
Fantastic. We're grateful for that. Thank you.
Hi, thank you. This is Subhish from Sadhguru Netra Chikitsalayya, India. We are one of the largest rural eye care provider. So I have a question to Dr. Prashant. But before the question, I wanted to share our view on that price differentiation we talked about. So we do 120,000 cataract surgery every year. That's the scale we do. In that, importantly, close to 20,000 is premium IOL surgery. And it's all happening in one setup. How do we do that? We differentiate the facility, right from, like Dr. Prashant also was mentioning, the waiting area, the air-conditioned room, separate menu in lunch, the imported lens to use. I think when you differentiate services a lot and it is clearly visible, people will go for it. I mean, there is a concept where people says, your money is going to support the poor. Nobody is interested on that. Yeah. End of the day, if I pay only if I gain out of something. Otherwise, what will happen? All of them either will go for free service or those who pay will find some other provider.
Got it.
But our model is clearly differentiating. So my question to Dr. Prashant is, you have mentioned the slides was really excellent, not the slides were really excellent. Not every organization present that, the cost recovery, which money goes to which segment and all. Thank you for that. So you have shown maximum number of centers is Vision Center. And there the cost recovery is 83%. So right now it is kind of supported externally. So my question is whether it will be going to be long-term 83%. I mean, you mean to have that model without recovery, or eventually that also will go for cost recovery like your secondary and tertiary level center?
So the profits that you are making from the tertiary care center or center of excellence, they are cross-subsidizing your work in the remote rural areas.
So you mean to
overall, and as an enterprise, you are still self-sustainable.
Yes, sir, absolutely. My question is, you meant to say Vision Center will always remain below a break-even point, or eventually that also come? That is my question. Definitely it is getting supported,
At Vision Center level, our objective is not cost recovery. I prepared this slide primarily to look at where we are in terms of cost. At Vision Center, we made a conscious decision that's our social enterprise. We are going to ensure that nobody should feel afraid of entering into that center and get their eyes examined. If you give that message into the community, I don't think so. If you have other means of cost recovery, that you should worry about cost recovery at Vision Center. The day we start looking at cost recovery at Vision Center, you will lose the sight of the social impact that you want to create in those communities.
Very interesting.
Okay, thank you.
Perfect stimulation for our coffee break. Thank you, Prashant. Katie, we've been beaten by the clock, but perhaps just a couple of final reflections, if you will.
Thank you, Ali. And I guess the thing that I'm taking away here is it goes back to, and this was a perfect segue, that really as we think about overall sustainability, I do think it comes back to establishing an ecosystem, right, for how the different elements between levels of patients can work together, how different parts of the organization can work together to ensure the overall sustainability. And I think, at the end of the day, as Reid talked about, that we're in an era of collaboration, and ideally we'd have NGOs or other organizations, many of us here, working together to establish an ecosystem that maybe individually we might not be able to get to full sustainability, but that together we can build the ecosystem that makes it sustainable long term, that will hopefully open the door then for whether it's a private sector or social enterprise or an NGO that can really create that long term. So, that inspires me as far as thinking about where do we go from here. But I do want to thank all three of you for sharing your experience and hopefully providing some models that can spark some thoughts for the rest of us. So thank you very much.
No, thank you very much to all three of you. And I would certainly second that, Katie. I thought not just collaboration, but also that idea of camaraderie. I've hosted the Great British Entrepreneur Awards for 10 years, and I work with some of the UK's leading charities, including the King's Responsible Business Network. And it just made me wonder this session, if the great entrepreneurs and CEOs of our age had a peer mentoring relationship with the great charity leaders, what would happen? So to continue to learn from each other. And this is what you're doing in action, I get it. So thank you for doing it already. Thank you, Katie, for leading us through it. Thank you.